Hello, I'm Dr. Stephanie Thomas, a board-certified nurse practitioner and the Wellness Director of Institute for Peak Health. I'd like to talk to you about how bioidentical hormones and the balance of these hormones can improve the quality of your life. As many of you might know, a hormone acts as a messenger within our body, and it sends very important messages from one cell set to another set of cells in order for proper functioning. In the study of aging, we know that the body reaches its peak at about age 35. From 35 to 40, and sometimes even earlier, we start to see shifts in these hormones that can have a multitude of effects in men and women. Oftentimes, these changes are also exaggerated or aggravated by stress, our health, or our lifestyle in general. For women, estrogen and progesterone should be well balanced, but progesterone can decrease in relation to estrogen due to the aging process or due to other stressors on our system. This leads to estrogen dominance, which is an age accelerator and can lead to a host of issues such as trouble falling or staying asleep, which often will lead to fatigue and difficulty getting through the next day. On top of that, we can see mood swings. Sometimes the female patient will find herself anxious or moody or irritable. For the woman that's still menstruating, she might notice other symptoms in correlation with her cycle. Testosterone is another key hormone that can dramatically decline due to stressors in life or on the body. Testosterone is very important for men and women alike. Testosterone is not just a male hormone. In women, it has all the same effects that it has in men. Testosterone is very important for the brain. At the level of the brain, we need testosterone to think clearly and sharply, so a decline in testosterone can make you feel like you have a foggy brain. It is also important for the cardiovascular system, healthy cholesterol balance, and healthy blood sugar metabolism. Testosterone is important for building bone and maintaining lean muscle mass, which is imperative to keep us mobile and independent as we age. Muscle mass is so important for us to maintain a healthy body composition by increasing our basal metabolic rate. A muscle cell will burn 9.5 calories a minute, and a fat cell burns only 4.5 calories a minute. So without adequate testosterone, it's very difficult for one to build muscle and burn fat. From a sexual standpoint, testosterone also has many benefits. Low testosterone in men or women can lead to decreased sexual desire, decreased sensation in the erogenous zones, decreased lubrication or erectile function, and even difficulty with orgasm. For men, hormone balance is also very important. Testosterone is your dominant hormone, but with aging, testosterone has a tendency to shift to estrogen. Men could become estrogen dominant as well, which again accelerates aging. We also know that obesity and alcohol consumption can cause the male patient to shift more of his testosterone to estradiol. That's why it's important to measure estradiol and testosterone when evaluating a man's hormone balance. So how might you know if you have an imbalance in your testosterone? If you're feeling tired, if you have low energy, if you're having a difficult time getting through your day. Maybe you have low motivation or your exercise endurance isn't the same. Your testosterone might have already started to decline. To figure out what your hormone balance looks like, the next step is to set up a consultation and get a simple blood test. We can evaluate your sex hormones with a simple, non-fasting blood test and talk about your options for achieving balance and improving your quality of life. One of the most advantageous and convenient options to help balance hormones is bioidentical hormone pellet therapy. Our founder, Dr. Bernice Gonzalez, and I were the first in San Antonio to offer this therapy over a decade ago. And since then, we've placed over 30,000 pellets in our female and male patients and have seen that this form of hormone replacement therapy has wonderful advantages for patients. The absorption is consistent and we can avoid drastically fluctuating hormone levels, which is the last thing you want when you're trying to maintain balance. We also know that using pellet therapy allows us to begin to achieve symptom relief within the first week or two, unlike other hormone replacement methods. The hormone pellet therapy produces the steadiest states of hormones over time, so it makes it very, very easy for those of us that are busy, as it's relatively low maintenance. For instance, in the female patient, the hormone pellet will last 3 to 5 months. In the male patient, the pellet will last 4 to 6 months. Pellets are administered in a very simple office procedure using a local anesthetic, so it's quick and virtually free of discomfort. No stitches are required. We will, though, ask you to avoid soaking in water or any major lower body workouts for a couple of days, but other than that, there's no real downtime. We are very excited to offer this beneficial service at the Institute for Peak Health. Our goal is working closely with our patients to address health from the root and help people to optimize their health and achieve their health goals. If you enjoy a personalized, non-rushed, and comprehensive approach to your health and wellness, the Institute for Peak Health is for you.